Hello, everyone. Welcome to this week's Lunch and Learn Live with Lynn. Welcome. Happy Thursday. It is a great day here in New England. I'm actually in Massachusetts, and the fall weather has been phenomenal. So I would encourage you all to get outside in your neck of the woods. I guess if you're in Florida, it might be a little difficult. Such a sad situation for people. My niece is in North Carolina. She's been without power, and her road was flooded out. So my goodness. So yeah, unfortunately for those folks, the October has not been a great month. But if you are in other parts of the country and the weather is cooperating, get outside, because it is so important to get your vitamin C and to be healthy. I encourage anyone that I talk to walk every single day, because guess what? Exercise, being healthy, is one of the number one ways that you can reduce your healthcare costs in retirement. And that is a great segue into the meat of today's Live, where I'm going to be talking about healthcare, women, and retirement. And some of the information I'm going to share might be kind of, depressing, especially if you're closing in on retirement and you don't feel completely prepared. But it is so important to know the information, to know the facts, so that you can at least prepare yourself as best as possible and figure out some strategies that can help you through this healthcare challenge. I would say up there with running out of money, healthcare in retirement is one of the top concerns. Healthcare overall, right? Because if we don't have our health, it doesn't matter how much wealth we have. Health is everything. So I want to share some stats with you. Then I'm going to go through some other information, and then I'm going to wrap up today's live Lunch and Learn with a checklist, and I will link the checklist in the comment section of this live video. So how will health affect your retirement savings? Like, what kind of bite will healthcare costs take out of your nest egg? That is the big question that so many people want to know about. And statistics, actually, from a number of different healthcare studies, Fidelity is one of them, say that the average 65-year-old couple who live, let's say, a 20-year retirement, so 65 to 85, will need $395,000 in out-of-pocket healthcare costs. And I'm going to break down those costs in just a moment. Typically, the woman has a higher percentage of that. So a woman's out-of-pocket healthcare costs are higher for a couple of different reasons. One is because of longevity. So longevity is the biggest risk we face in retirement. And it's one of the risks that basically affect all the other risks, right? Because the longer you live, the more subject you are to inflation and interest rate risk and healthcare cost risks. And so there's a blessing and a curse to living longer. And, it affects us women more. Also, some people believe in something called the pink tax, where women are charged more for certain things, certain products, certain services. And so that's another issue that can potentially drive up our costs. Medicare, right? A lot of people say, well, I'll be covered by Medicare. Well, yes, Medicare at 65, but Medicare may only cover about 80% of your healthcare costs. And Medicare doesn't cover long-term care costs. Now, also to note, in that $395,000 estimate that I gave you, that does not include any long-term care costs, okay? So how confident are you in your retirement healthcare savings? So do you have a separate savings account or a separate bucket of monies reserved for healthcare costs? A lot of us don't. I'm going to talk about health savings accounts and some other ways to get around this, or if we have a long-term care incident and we're not prepared financially, there are some ways to cover this. Only 50% of adults age 50 to 64 are confident that they can afford the costs of healthcare in retirement. So that's a pretty low confidence number. And this is one of the reasons, one of the things that I'm trying to educate women about prior to retirement so that we can be better prepared for these obstacles and these challenges. And certainly healthcare costs is a huge challenge. On the good side is, and I kind of kicked off today's session with this thought, is people who get healthier. Okay, so maybe you've been healthy your whole life, which is great. But if you dedicate yourself to getting healthier, people who are healthier in retirement save as much as $10,000 to $100,000 in healthcare costs. So when you're sitting, on the couch and you're like, oh, I should probably go out and move my body. I should probably start an exercise routine. I should probably eat better. Well, guess what? It's going to make your retirement better because you're going to feel better. You're going to be healthier, but it can impact your pocketbook. Okay. It will allow you maybe to spend money on something else rather than on expensive prescription drug costs or coinsurance or deductibles. And I've done some podcast interviews on this topic, but when I speak to healthcare experts, fitness and nutrition experts, they say that 80% of our health is within our control. 20% is genetic. So if we have that much control over our health and therefore the costs of poor health, that's a really good motivator. And it also, gives you such a much better attitude and your ability to handle stress. And there's so many benefits to getting HealthiHER. All right. So, by now we probably know that healthcare is one of the largest expenses in retirement for most Americans after housing and transportation costs. Unlike previous generations, we're unlikely to have access to employer or union-sponsored health benefits. And, this is going to be the fact that healthcare is going to take up a larger part of many of our retirement budgets. So planning is imperative. And if you have a younger person in your life, man, woman, couple, whatever, highly encourage them to be prepared for their healthcare costs and to focus on their health throughout their lives, because if it becomes a habit early on in your life, then it's something you never abandon. Lots of things are impacting this. Living longer, like I said, longevity, healthcare inflation. We talk about inflation, but healthcare inflation continues to surpass general inflation, unfortunately. Medicare inflation is outpacing Social Security cost of living increases, so that's an issue. 62 is the average retirement age for many Americans, and that's an issue because it's 3 years prior to being able to enroll in Medicare. So some of those costs come into play between 62 and 65 because you don't have that Medicare coverage. Maybe you're paying for out-of-pocket costs during that time. So there is a retirement cost gap for many pre-retirees created by healthcare. And, to add on, quite a number of people believe that their healthcare costs will be covered by Medicare, which, as I mentioned earlier, is, a misnomer. And, to add on, approximately 15% of the average retiree's annual expenses will be used for those healthcare costs. So if you're looking at your budget for retirement, you have to carve out and say, okay, 15% of that budget will likely go to healthcare costs, or on average will go to healthcare costs. This includes your Medicare premiums and any out-of-pocket costs. Now, just as a side note, Medicare premiums can go up in retirement via something called an IRMA surcharge, which is an income-related monthly adjustment amount. I have an on-demand webinar all about IRMA for people that are over the income limits for Medicare, and that can make your Part D and Part B Medicare premiums go up. And you can check that out at irmawebinar.com if you're concerned with either having a one-time event like selling a home, which can drive up your Medicare premiums 2 years later after you sell that home, or if you are in general going to be in higher income brackets in retirement and you are worried about being subjected to IRMA, there are ways around not paying more. So these numbers don't even take into consideration the people that could be impacted by IRMA. And there'll be 8 million people getting letters this year about their about their Medicare premiums going up. And whether you need to file an appeal or you need to do some tax planning, you can learn all about those resources in the IRMAwebinar.com event. It's an on-demand event, and I have a whole bunch of resources there, appeal letters, case studies, and so on and so forth. So on top of your regular Medicare, some people are going to have to pay this IRMA premium because they didn't have anyone helping them figure this out and helping them understand that that could be an issue that drives their Medicare costs even higher. So like I said, the average couple is $395, over the course of a $395K over the course of a 20-year retirement. I've seen estimates for women anywhere from $165,000 up to $200,000 in out-of-pocket costs, which are pretty staggering amounts. The way it breaks down is about 43% on average goes to Medicare Part B and D. 47% of that budget goes to co-payments and deductibles, coinsurance, and another 10% goes to prescription drugs. Obviously, these breakdowns vary depending upon your health, where you live, when you retire, your health status. Additionally, the types of accounts that you use to pay for healthcare can also play a pretty big role in your costs. So for instance, with a 401k or a health savings account, not to be confused with a flexible spending account, a health savings account is what I talk about in my Her Retirement Masterclass to encourage women to make sure they look at health savings accounts before retirement. You can often get them through your employer. If you're self-employed, there are companies that offer health savings accounts, and I can connect you to those companies if you'd like a connection. But a health savings account is a triple tax-free way to pay for healthcare in retirement. So the money goes in tax-free, it grows tax-free, and you can take it out tax-free. It is probably the number one retirement investment that you can make. And then the idea is that you use the money that you save and invest down the road for those retirement healthcare expenses. And if you don't, you just pay the tax on it. It's no longer tax-free if you use the money for things other than healthcare. So health savings accounts are really, really important. All right, next thing I want to talk about is, just side note here is health savings account. You have to have a high deductible health plan. I actually signed up for one this year and jumped on the HSA bandwagon to save as much as I can prior to my own retirement. As you approach retirement, you're going to have a number of decisions to make, right? It's just decision laden. I actually have a milestone chart. When you go to herretirement.com and you first go on the site, there's a pop-up and it says, would you like to download our milestone chart? And this is a chart that reminds you of these age-based milestones and the decisions that need to be made for each of those age-based milestones. In addition, when you subscribe to my Retirement Readiness software platform, we have an automatic milestone minder. So when you subscribe, you enter your name, your date of birth, and then you're going to enter a whole bunch of information about yourself also. But one of the features of the software is it's going to automatically send you an email as you approach those milestone dates. And it's going to say, hey, Lisa, you're about to turn 50. Do you know that you can make catch-up contributions? Or, you're closing in on 65. Here's the Medicare decisions you need to make. So it's pretty cool because it reminds you of all of those milestone ages and the decisions. There are a lot of decisions, And, my platform, if you've been following me, it's really designed to help women make informed decisions and to have more informed conversations with the experts that are helping you. One of the decisions is, when to stop working, when to take your Social Security, how to pay for healthcare, how to generate cash flow from your retirement assets, from your nest egg. These decisions are really interrelated, and that's why I talk about them, and I talk about them in my masterclass, and how they can't be made in separate silos. They have to be made together because they are interrelated. And so you have to prioritize and decide wisely, what will impact your living costs and your lifestyle in retirement, and then use all of that information, the data, to decide when is the best time for you to retire based on your particular situation. About 1/3 of those who retire early claim, and I call early is 62, claim Social Security at 62. This can help people pay for those health-related expenses until they qualify for Medicare. So that's one strategy. I'll take my Social Security and then I'll have money to pay for my healthcare. However, if you're in a position to delay your retirement or have enough savings that will cover your healthcare costs between 62 and 65, you may decide to defer your Social Security benefits. Now, of course, Medicare comes out of your Social Security. So once you turn 65, your Medicare premiums are going to be taken out of your Social Security check automatically. That's one cost, right? That's whatever it was, 44, 47%. And then you have all those out-of-pocket costs. But if you wait longer to claim Social Security, a couple things can happen. Social Security increases by about, I want to say, 8% per year the longer you wait. So it can be advantageous if you plan to continue to work and you don't have the means to pay for those healthcare expenses. Maybe you decide to continue to work and delay Social Security until full retirement age, which is like 66 to 67. A majority of people don't have an employer-sponsored pre-65 retirement health plan. Okay, this means that if you retire before 65, you're going to have to come up with the coverage. And so there are some different options available to people. There's COBRA continuation. So if you're a former employee, you have COBRA continuation, and very few employers subsidize COBRA. So you may need to pay the full cost of that coverage, which is not inexpensive. Of course, there's your spouse's health plan or partner's health plan. And, not all employers offer that benefit, of course, and special rules or surcharges may apply. And then, of course, there's the public marketplace. Obamacare is what it was called. And, you may qualify also for federal assistance based on your income for that care, or you pay out of pocket. I know as a self-employed individual, our family plan, I want to say, is about $1,800 right now. And then we have all the deductibles. I have a high deductible health plan. So yeah, our healthcare costs are pretty expensive. Now, of course, once the last 2 children are off that plan and it's just myself and my partner, that will be significantly lower. And, I'm starting to kind of look at what that will be, what those healthcare costs will be. But, in our case, my case, I don't plan to retire before collecting Medicare. And then, of course, there's private insurance. So those are the 4 options at this point in time. And it will be interesting. There's a lot of talk in the political circle, right? We're in an election year. What is the healthcare plan? When Trump was in office, he decided to keep Obamacare intact. I know he talked about kind of blowing it up and coming up with a new plan. To be honest, I don't even know Kamala's plan for healthcare. But yeah, it's an issue. And we're going to have to see whoever comes into office, what kind of healthcare adjustments, changes are going to be made. So as you approach 65, it's, very important to start thinking about which Medicare plans make the most sense for you. You'll be eligible, of course, at 65, and you'll have a 7-month window to sign up for a plan beginning 3 months before your 65th birthday. Okay. And there's a lot of information that you really need to be aware of in regards to Medicare and, the different parts A, B, and D, as well as Medicare Advantage and Medigap supplemental insurance plans. Now, in brief, Part A is just the first part that covers hospital expenses, but you have to pay a deductible before these benefits start. And then you have Part B, which is optional. Part of Medicare, it covers medical expenses, and it requires an annual premium. And another optional part of Medicare Part D is those prescription drug coverages. And then there's Medicare Advantage plans. They're all-in-one managed care plans that focus on providing these services covered under Part A and B of Medicare, as well as other services that aren't typically covered under these parts, such as the Part D drug coverage. And then there's the supplemental policies known as Medigap policies, which are offered by private insurance companies to supplement expenses that aren't covered in Medicare Parts A. So one of the things that I do a couple things. One is I have a free webinar. You go to medicareforher.com, medicareforher.com. It's like a 20-minute, really basic overview of Medicare. You can go check that out. And then I have a longer course on healthcare, Medicare, and long-term care on the HER Retirement website under the Learn tab. When you go to the homepage, go under the Learn tab, and you can purchase for $37. I have I want to say it's an hour, maybe an hour and a half webinar, e-class, I call it, on Medicare, healthcare, and long-term care. So that goes into a lot more detail than the one that you find at medicareforher.com. And then in addition to the class, you get access to a bunch of different Medicare resources. But I do highly encourage you, whatever you use, whether you use HER Retirement resources or other resources, I do highly encourage you to get somewhat educated about Medicare. The other option is I have a couple different resources in my network of professionals, and I can refer you to a couple different people. One person that I have, Marcia, she does Medicare consulting on a flat fee basis. So she just charges you a fee. She's not affiliated with any insurance companies, and she will just consult with you on what is your best options for Medicare. Great lady, very knowledgeable. I can refer you to her. Or I do have two other providers that base their Medicare consulting with you on the fact that they have relationships with all these insurance companies. So they basically go shop for you based on your needs. They meet with you. They understand what your situation is, what you're looking to do, and they go shop, and they, basically an insurance agent who will match you up with the best solutions for you. So have a couple different options there for you if you need Medicare support. And, after you educate yourself somewhat, because I always believe that you can make more informed buying decisions if you spend a little bit of time understanding the basics, and then, meet with these folks. I do know Marcia does a fair bit of educating you kind of one-on-one. So perhaps that's how you'd want to approach this. Let's see, I have a tip. If you're having to pay out of pocket for office visits, let's say, it's better to consider paying a higher premium. Analyze the cost of yearly premiums and copays at different levels of supplemental insurance. Compare the costs, and then take into account the number of visits and copay, coinsurance per visit that you anticipate for the next year. You are not locked into a Medicare plan forever. You can switch plans as your needs change on an annual basis, and I'll talk about that in a minute. It's usually best to enroll in Medicare Part A, B, and D when you first become eligible, because there is a penalty for enrolling later if you don't have qualified coverage under your employer. Now, what if you're turning 65 and you're still gainfully employed, or your spouse or partner is? If you're still employed when you turn 65 and you have health insurance through your employer or your spouse's employer, you'll be eligible to enroll in Medicare through a special enrollment period when you leave your employer's plan. And there's a few things to consider when it comes to Medicare. If your partner or spouse is still working, they may be able to cover you through their health plan. And, in that case, you should definitely speak to your spouse's HR department in order to help you evaluate your options, your costs, and any restrictions. Medicare can be difficult to understand. That's why they call it the Medicare maze for a reason. So ask, what are your health needs and which plan covers them best? And your employer offers you coverage, but are there better options outside of your employer? So sometimes people will say, is it better to go on Medicare after 65 and versus staying on my employer's plan? So this is where, your employer could help you answer some of those questions, but I think someone like, I mentioned Marsha is a really good consultant to help you make that decision, or one of the companies that I talked about, the insurance agents. Another question, is it more costly to stay in your employer's plan or join Medicare, right? Obviously, you want to try to go for the best plan for you and your situation at the least amount of cost. And if you leave your current job, can your partner still stay on the health insurance plan? I think a key goal is to cover the gaps or make sure you don't have any gaps. I talk about, we work really hard to help women make sure they're not going to have any gaps. And if they do, how do we cover the gap, whether that's in insurance, in, retirement income, whatever it might be, estate planning. It's all about making sure you understand your risks, right? We have risks that we need to face. How are we going to mitigate the risks, and how do we cover the gaps? When you are planning your retirement, and how to pay for your healthcare expenses, it's important to take into account how much you will need as you age, right? Because obviously, as we get older, we might generally need to spend more on healthcare services. And there are things you can do, right? For example, like I said, if you're 50 or older, you can make up for a savings shortfall with additional catch-up contributions to 401ks, IRAs. If you're 55 and older, you can make additional $1,000 catch-up contributions to those health savings accounts. So the government does allow us to add a little extra as we get older. So that's a good thing. Medicare open enrollment is October 15th to December 7th. This is when you can look at your Medicare plans and your situation and make those changes each and every year. And it makes sense to analyze those decisions, those choices in your situation each and every year. Again, coming up here in 5 days, October 15th to December 7th. So if you're already collecting Medicare, definitely reach out and I can connect you with those resources to help you make some good decisions. I'm going to also provide some important links to help you get further educated. There's an ARP healthcare cost calculator. I have a couple other cost projectors from a few other companies. And we have a Fidelity healthcare cost estimator that can help you potentially estimate those costs. And again, if you want to check out my Medicare for Her, it's like a 20-minute webinar overview, high-level overview on Medicare, or you can go check out my Medicare healthcare and long-term care e-class on the HER Retirement website. All right, so I was hoping to get this done in 30 minutes, but what I'm going to do is quickly go through this healthcare and retirement checklist, and then I will link this also so that you can print it out and you will have this healthcare and retirement checklist. And I'll probably post it as a blog post on the HER Retirement website also. So number one, understand Medicare, know when to enroll, know the Medicare part breakdowns, part A, B, C, and D, understand what isn't covered. So for instance, original Medicare doesn't cover dental, vision, hearing, or long-term care. Look into supplemental insurance or Medicare Advantage for these. Explore Medicare supplements, Medigap plans. Make sure you shop around because Medigap premiums Medigap premiums vary by provider. And, you really got to compare those costs and coverage. Long-term care planning, it's, I guess it's like 1 in 5 people, over the age of 60 need some type of long-term care, have some type of long-term care need. And one of the ways that people might pay for long-term care is doing something like a reverse mortgage on your home, leveraging the asset of your home to pay for those emergency healthcare needs, whether it's a long-term care need or some other healthcare need. So often people will set up a home equity conversion mortgage, just keep it there in case the need arises. It's kind of a good plan B if you have those unexpected healthcare costs. It is a way to cover those. A lot more information on reverse mortgages and how those can be used in retirement. So assess your needs for long-term care insurance. Consider if you'll need help or your spouse will need help. One of the issues with couples, especially, men and women, typically the man passes away before the woman, and should that man become sickly toward the end of his life, oftentimes if a couple's not prepared, the nest egg can go to providing care for him, leaving the woman with little to no nest egg for her own needs, for her own financial needs, and maybe her own healthcare needs. So when you're coupled up, you really, really need to pay attention to those joint needs and the joint nest egg and how that could be impacted, and vice versa, right? It could be the woman getting sick, and I have an acquaintance, I guess, whose wife passed, and he was forced to sell his home just because financially they just weren't prepared. Number 4 is managing prescription costs. So you want to review those Medicare Part D plans, and there's something called the Extra Help Program, if you qualify, which lowers prescription costs for low-income retirees. And you want to explore generic and discount drug programs. And the Inflation Reduction Act, signed in, last year, did lower the cost for some prescription drugs. However, there's argument that, it lowered it for some drugs and the cost for some people, but it ended up raising costs on other drugs for other people. So yeah, it's one of those tenuous discussions. Number 5 on the checklist is health savings accounts, maximizing and taking advantage of those health savings accounts if you have access to them. And you can use your health savings account to pay for Medicare Part B, D, and Medicare Advantage premiums. Number 6 is healthcare costs in retirement. Very important to estimate those future healthcare costs. In that same retirement readiness software platform that I have on the Her Retirement website, we actually have a smarter spending tracking tool. And in that tool, you calculate there's 2 spreadsheets, if you will, but there's a smarter spending tracking tool for your pre-retirement expenses and one for your retirement expenses. And if you're pre-retirement, it's good to complete the retirement one, go through all your projected expenses, including your healthcare expenses, to get a really good sense of what your expenses will be. And then this is all part of retirement income planning, but then compare that to what your income sources will be, and you can get a glance and a view into what your cash flow will be in retirement before you get to retirement. And going through this exercise makes sure that you don't miss anything and that you don't underestimate anything, right? You don't want to underestimate those healthcare costs and be caught by surprise. Number 7 is evaluate your healthcare options before 65. What is that bridge to Medicare? If you're retiring before 65, looking at COBRA, spouse's plan, the ACA marketplace / Obamacare to cover the gap until you get to Medicare eligibility. 8, preventative care, right? I was going to the doctor the other day, and I saw a slogan for a hospital, and it said something like, we help you recover. And I was like, wouldn't a better slogan be like, we help you we help you stay healthy. We help prevent you from getting sick in the first place, right? Our healthcare system is all about reacting to illness and recovery, which I guess, is important, but how about prevention? So Medicare covers many preventative services, including mammograms, ladies, so important, colonoscopies, and flu shots. So stay on top of screenings and vaccinations and focus on your health. I call it HealthiHER. Regular exercise, watching what you eat, staying engaged in activities, mental activities, physical activities, because our physical health, right, is so important, can help lower healthcare costs. Again, anywhere from $10,000 to $100,000 could be saved by being HealthiHER and improving the quality of your life overall. Number 9, discuss end-of-life planning. Prepare those advance directives. Consider, hospice and palliative care. Just have a plan for that should you or your spouse need that care. And then understanding retirement communities or assisted living, explore housing options, investigate those communities and facilities that offer healthcare. Number 11, stay informed of policy changes. Monitor Medicare updates. I try to keep people up to date here on YouTube and on my social media, on TikTok, through email, my newsletter. Medicare policies change, so you want to stay informed and make sure that you check what you need each and every year. Review your Medicare options and your needs. And finally, 12, check the benefits you qualify. There's a service called Benefits Checkup, so you can see if you qualify for programs to help cover healthcare costs, including Medicaid, which is really Medicare for the impoverished. And, maybe you qualify for some assistance with those Medicare premiums. And then I should add to this checklist, but you want to make sure that if you are going to have either a one-time event or higher income in retirement, and I would say like over $103,000 of income in retirement for a single person, you want to make sure you understand IRMA, the income-related monthly adjustment amount, and stay on top of that, because people are getting surprised. They're thinking their Medicare premium is going to be $174 a month, and they get an IRMA letter and it's $500. So you want to make sure you understand IRMA. And then investigate state and local programs. Some states offer additional benefits, especially for low income or disabled retirees. So I'm just going to review a couple of the resources that I talked about today. My Medicare webinar, it's like 20 minutes. It's medicareforher.com. Or you can go purchase access to my Medicare, healthcare, and long-term care e-class at the HER Retirement website. You just go under the Learn tab. You'll see the courses that I offer. That course is one of them. They're $37. And in addition to the class, you get access to a bunch of different resources, printed materials and guides and so forth that can help you with your Medicare decisions. I have a few different Medicare providers who can help you make your Medicare decisions. Just reach out to me, Lynn at herretirement.com, and I can hook you up with those providers. And then finally, I'm going to do a little plug, because it's a great time of the year to start thinking about the next year. And I have my HappiHER, HealthiHER, WealthiHER journal and planner. And it's broken down into 3 sections: health, wealth, and happiness. And this one is a journal and a planner. I have one without the planner part, which, is like the weekly planner. So my other one is just a journal. And there's a whole bunch of different exercises within each of the health, wealth, and happiness spaces. So there's cash flow, financial goals. There are journal prompts where you can write, what feelings do you have about money and health. There's a dinner planner, bedtime habits. Under the health, there's a 52-week weight loss tracker, a food journal. There's, in the happiness section, there's, place where you can keep track of all the things you're reading. So I've tried to include a lot of different things in this HappiHER, HealthiHER, WealthiHER journal and planner, all about her. And you can go check that out at hhwjournal.com, hhwjournal.com. Might be a good thing to pick up for yourself or a gift for someone, as we are closing out this year soon and starting a brand new year where we have all of those New Year's resolutions. So again, if you have any questions about healthcare in retirement, reach out to me. And my message is to prepare as best as you can by being healthy and also making sure you have some financial strategies in place to help you pay for those healthcare costs in retirement. So thanks for watching today. Reach out to me if you have any questions, lynn@herretirement.com. And until next week, here's to being healthy her. Thanks for watching.